Natural ways to relieve constipation. Constipation is a common digestive disorder characterized by infrequent bowel movements, difficulty passing stools, and/or incomplete evacuation of the bowels. It is usually defined as having less than 3 bowel movements per week, although this can vary depending on the individual. Symptoms of constipation may include abdominal pain, bloating, and a feeling of fullness or discomfort in the lower abdomen. There are several remedies for constipation, including increase fiber intake. Increasing fiber intake can help alleviate constipation by adding bulk to the stool and making it easier to pass. Fiber is a type of carbohydrate that is not digested by the body, so it passes through the digestive system relatively intact. In the large intestine, fiber absorbs water and swells, which helps to soften the stool and make it easier to pass. There are 2 types of fiber, soluble and insoluble. Soluble fiber dissolves in water and forms a gel-like substance, while insoluble fiber does not dissolve in water and adds bulk to the stool. Both types of fiber are important for maintaining healthy bowel movements. Fiber-rich foods include fruits, vegetables, whole grains, and legumes. Some examples of high-fiber foods include apples, pears, and berries, broccoli, carrots, and leafy greens, whole grain bread, pasta, and cereal, brown rice, quinoa, and barley, lentils, beans, and chickpeas. Stay hydrated. Staying hydrated can help alleviate constipation because it helps soften stools and makes them easier to pass. When you don't drink enough water, your body can absorb too much water from the stool, making it hard, dry, and difficult to pass. Drinking enough water and other fluids helps to keep the stool soft and easy to pass. The recommended amount of water intake varies based on age, sex, weight, and activity level. In general, it is recommended to drink at least 8 glasses of water, or about 2 liters, per day. Other fluids, such as herbal tea, soup, and fruit juice, can also contribute to daily fluid intake. It is important to note that consuming certain beverages, such as alcohol and caffeinated drinks, can actually dehydrate the body and make constipation worse. Therefore, it is best to limit or avoid these types of drinks if you are experiencing constipation. Exercise regularly. Regular exercise can help alleviate constipation by promoting regular bowel movements and improving overall digestive health. Exercise helps to stimulate the muscles of the digestive system, which can help move food and waste through the digestive tract more efficiently. Exercise can also help to reduce stress, which can contribute to constipation. Aim for at least 30 minutes of moderate intensity exercise, such as brisk walking, jogging, or cycling, most days of the week. You can also incorporate specific exercises that target the abdominal muscles, such as sit-ups or yoga poses like the downward-facing dog, to help stimulate digestion and bowel movements. Try natural laxatives. Natural laxatives can help alleviate constipation by promoting bowel movements and helping to soften stools. Some examples of natural laxatives include prunes. Prunes are high in fiber and contain a natural laxative compound called sorbitol. They can be eaten whole or as juice to help stimulate bowel movements. Flaxseed. Flaxseed is a good source of fiber and contains both soluble and insoluble fiber. It can be added to foods like oatmeal or smoothies to help alleviate constipation. Psyllium husk. Psyllium husk is a type of soluble fiber that absorbs water and forms a gel-like substance in the digestive system. It can help soften stools and promote regular bowel movements. Aloe vera. Aloe vera contains compounds called anthraquinones, which have a laxative effect. Aloe vera juice or supplements can be used to help alleviate constipation. Senna. Senna is an herbal laxative that works by stimulating the muscles of the intestine to help move stool along. It should be used sparingly and only for short periods of time, as it can cause cramping and dehydration. Seek medical advice. If constipation is severe or persists for more than a few days, it is important to seek medical advice, as it may be a symptom of an underlying medical condition that requires treatment. It is important to note that if constipation is accompanied by symptoms such as abdominal pain, nausea, vomiting, or bloody stools, it is important to seek medical attention immediately, as it may be a sign of a more serious condition.